Hey guys, Dr. Jeff here. We're going to go over some arm stuff today. So, just because you have tingling in the hand does not always mean that you have carpal tunnel syndrome. Tingling in the hand can be caused by a number of other compressions throughout the arm. And as a chiropractor, we take that all into consideration. So when you come in and you say you have carpal tunnel syndrome, first thing I ask is, who told you that you had carpal tunnel syndrome? Was it you checking it out online? Was it you going to a medical professional? Was it you going to some other friend or family trying to figure out what you have? If you feel as though just because you've got tingling in your hand you have carpal tunnel syndrome, I want to do my own evaluation on you to make sure that it truly is carpal tunnel syndrome. Even if you come from a medical professional and they tell you it's carpal tunnel syndrome, I still do want to do my own neurological workup on you, because a lot of times we do find that there is some subtle compression happening in the neck area here that can be causing some of the tightness, some of the tingling in the hand as well. So when you come in with the tingling in the hand, we evaluate the neck first, because the nerves that come out of the neck, the only way that the nerves get out into the hand here is from this neck right here. So the brain, the cord comes down the center, and right here in the neck, the only way that anything gets out into this arm is through the neck. That's it. So if there is compression here in the neck from arthritis or a disc herniation, that will cause tingling or pain or dysfunction in the hand. All right, so it's very, very valuable and very, very important to make sure that we rule out any potential other locations of nerve root compression when we are treating stuff in the arm itself. And again, that's why I feel we are great providers for helping you differentiate between other types of conditions, because we aren't just going to look right at the central location of your irritation. We're going to look at the whole biomechanical pattern that moves back into the neck there, and making sure that the nervous system is functioning well as it exits the spine. So in my experience, I've treated over 40,000 patients, and I've seen a lot of different variations come into the office. I've seen patients have tingling in the hand due to nerve root compression. We just focus on the neck and it resolves their carpal tunnel symptoms or their tingling in the hand symptoms. I've seen patients that come in, the neck is fine, and they have some compression in the elbow here, which is affecting the tingling in the hands. We've seen what's called radial distribution of the radial nerve out into the tingling of the hands. We've got to figure out exactly what the primary player is causing the compression of the nerve, giving you the tingling sensation in the hand. Now that's carpal tunnel syndrome. Now what we do also for elbow stuff is we evaluate the inside and the outside of the elbow. We treat things such as tennis elbow, golfer's elbow, we treat little leaguer's elbow, and all those are tendonitis or tendinopathies. And all it is an inflammation or irritation of the muscle and tendon. So what we do is we find out what muscle or tendon is inflamed, and then we massage or do our myofascial work, such as Graston technique, or even dry needling to the trigger points of the affected inflamed tissue. So in tennis elbow's case, tennis elbow, typically they call it this because the backhand of the tennis racket can aggravate the outside of the elbow here. Now it typically causes radial head pain here, right, in the outside of the elbow, and it usually aggravates when people do extension of the wrist, because the muscles that do finger and wrist extension all insert and attach in this outside of the wrist. So what we do is we find out exactly where the most irritated area is of the forearm, and we use our myofascial work on that area and give you strengthening exercises to do on your own. And then again, we also talk to you about your at-home lifestyle activities, anything that you could be doing. Maybe you're not a tennis player, but you've got tennis elbow. What the heck are you doing to give yourself tennis elbow? And we help you figure that out. You've got to be doing something, because the elbow doesn't just inflame and become irritated when you don't aggravate it. It always ends up happening from a repetitive stress or repetitive straining with your activities of daily living and your lifestyle habits. So we help you come to a conclusion as to how to better that area and give this area a break. Now as for the golfer's elbow is typically the inside of the forearm. So golfer's elbow, you'll have pain here and then through here as well. A lot of times golfer's elbow can inflame this tissue enough that it gives you carpal tunnel symptoms or the tingling in the hands. Because if you remember at the beginning, we talked about this tissue becoming inflamed and aggravated and compressing this carpal tunnel. So pain here, but ultimately irritates all of this musculature here. So same idea as with tennis elbow or that outside tendinopathy. Inside pain is typically a tendinopathy or tendinitis. Again, a fancy word for people that want to try to sound smart. It's just inflammation of the musculoskeletal system right here of the forearm flexors. They flex the forearm this way, and what we do is we either, again, dry needle, Rastin, massage the tissue right through here, and then find out what your activities of daily living are that could be aggravating this area repetitively. This is big time in our current age because a lot of people are stuck in front of the computer typing a lot. All right? Now, with all of these conditions, the only way that these muscles move in the arm, like I said at the beginning, is from motor function coming through the neck nerves right here. So, with all issues that come in with this arm, we always evaluate the neck. We gotta check this neck out, make sure everything is nice and healthy, and you don't have any abnormal irritation going on up in the neck there, and we take care of it. And one of the ways that we can rule this out, or rule out any sort of other issues that could be stemming from the neck, is why we have the x-ray in the office. We have digital x-ray in the office, so we make sure that we, if we need to, we can x-ray the neck and see if there's any sort of crazy stuff going on in there. Very rarely is there ever anything odd going on in there, but we can always rule it out, and then we can see if there's any arthritis or potential for nerve root irritation from disc herniations, and we can help you get better. Thank you.